Medical fear questioning this morning if primary care doctors are carrying a heavier mental health load.
This morning, I take a deeper look at doctors treating patients suffering with mental health issues. Would you ask a cardiologist to deliver your baby? How about an obstetrician to control your diabetes? Most likely not. So why are so many primary care doctors diagnosing mental health issues?
I think that it would be unethical for a primary care provider not to help a patient with mental health issues.
For 27 years, Dr. Cassetta's daily routine is treating sore throats, completing physical exams, and most recently, diagnosing depression.
Each provider has their own comfort level with how far they want to go with treating depression and mental health issues.
His limits with mental health diagnoses can sometimes be a blurry thing. Is it okay for him to help the newly divorced single mom, but not the soldier suffering with PTSD? Not in his eyes.
Listening to what the patient has to say is really the key to helping with a patient with a mental illness. And sometimes that's all it takes to treat a mild depression, is just to listen to what they have to say and offer follow-up and maybe arrange for some supports.
A 2009 study from the University of North Carolina found we need 25.9 psychiatrists per 100,000 people to treat everyone with a severe mental illness. But researchers found there was only 10 per 100,000. Due to the lack of this type of health providers, Cassetta and psychologist Dortona decided to team up together.
I work closely with many primary care doctors in terms of treatment, and they're providing medication management for the patient. The patient's comfortable doing it, they're comfortable with their doctor, so it works out very well.
Even though there is a high demand for mental health care providers, in 2015 there is still a stigma attached to a patient coming in and out of these types of offices.
Many people are much more comfortable going to their primary care doctor if there's some mental health concerns, whether it be depression or anxiety, just because it's convenient. They often have a good relationship with their doctor knows them well. It's just easier to do and more comfortable for them.
When patients take their primary care doctor's advice to go see a specialist, getting an appointment in a decent matter of time is another struggle both patients and doctors have to overcome. March 27th, that's the first day available. Not until the first week of March. That's the earliest appointment you have?
That's really just as simple as it gets. There's just not enough supply of psychiatrists and mental health providers to take care of all the patients with depression and other mental health problems.
But it is not just an issue here in the Twin Tiers. The lack of mental health doctors is sweeping the nation.
We have too few mental health providers, and one of the reasons we have too few mental health providers in the country is because we don't pay them very well. Insurance doesn't reimburse them adequately, and it doesn't really make it worth the while of people who are in school to decide to go into those professions.
However, with education, good old-fashioned talking, and sometimes medication, doctors believe the you know and love will come out and shine once again.
Unfortunately, we have medications available that are safe, effective, and inexpensive.
The best treatment is a combination of therapy and medication. That's where the best outcomes have been achieved.
And for more information on mental health doctors here in our area, or to get more information about caring for depression and anxiety, head to our website, mytwintiers.org.